The following portion of Daytime is sponsored by Moffitt Cancer Center.
Since the passing of Black Panther star Chadwick Boseman at age 43, there's been greater interest in colorectal cancer research and how younger adults are being diagnosed more frequently. African Americans are also at a higher risk for colorectal cancer. And joining us with more on these statistics is Dr. Mokenge Malafa with the Department of Gastrointestinal Oncology at Moffitt Cancer Center. Thank you so much for being here. How are you?
And thank you, Fallon. Thank you for having me. It's a pleasure.
This is such an important issue. At what age should people start getting a colorectal cancer screening?
So the normal risk individuals should get screened at age 45. But if you have some risk factors, we may actually want you to be screened earlier. For example, if you had a family member who developed colorectal cancer at, say, age 50, you may want to start screening almost 10 years earlier than that. Yes.
Okay, and then talk to me about colorectal cancer and specifically the Black community.
Yes. So colorectal cancer is one of those cancers, unfortunately, that has a higher rate and also a higher death rate in the Black community. So we're 20% more frequent development of colorectal cancer in the Black community, and also about 40% risk of dying, higher risk of dying after developing colorectal cancer.
Wow, and that kind of brings us back to like when we talked about Chadwick Boseman. What are the factors for, you know, why a young person would possibly be getting colorectal cancer?
Yeah, those factors include the fact that it could be what we call inherited, meaning that there may be genetic factors, which, for example, you know, that you inherit a gene from one of your parents, and so that puts you at risk to develop polyps and so to develop cancer. We also know that sometimes environmental factors may be playing a role, you know, in that. And also, you know, just lifestyle and things like that could also have an influence. But most commonly, when we have a very young age individual, we always have to worry about kind of the genetic background and the familial risk factors. Yes.
Gotcha. And what is Moffitt's approach to treating colorectal cancer and leading the charge in stopping this?
Yeah. So we take a very comprehensive approach. So we have a multidisciplinary team which involves caregivers that include doctors, dietitians, you know, patients that social workers, you know, people who look at comprehensive, you know, care for the patients. So our approach is to when we see a patient, to make a clear diagnosis of colorectal cancer, and to be sure that we do a thorough evaluation to determine what stage they are and what kind of molecular characteristic of the cancer they have. Therefore, we can personalize their care and give them the best care to get the best results.
Great. And how does someone go about getting an appointment at Moffitt?
They just have to call our 800 number, and they could get an appointment. They do not need to get a referral.
That's awesome. No referral needed.
Yes.
All right, doctor, thank you so much for being here today.
It's a pleasure. Thanks for having me.
All right, and for more information, you can visit moffitt.org/outcomes. Daytime will be right back.
The preceding portion of Daytime was sponsored by Moffitt Cancer Center.